Hello, hello, Hezro. We can't hear you. Or is there someone speaking?
Is anyone speaking?
Hello,
Not
hello
yet.
everyone. Good evening, everyone. Welcome to this session today, where we'll be having a webinar on medication errors. And I'd like to invite everyone, maybe for those who've just joined us on the chat, maybe you could just mention where you're joining us from as we wait for more members to join us. Dr. Aniz, are you there?
Yes, I'm here. Thank you very much, Hezron. Let's just give it a few more minutes. We wait for a number to reach a good number, and we start. Let's just give it another 3 minutes. In the meantime, kindly let us know where you're joining us from, and also tell us where you're joining us from and whether you're a pharmacist or you're a student, because today we have the students with us, and this is part of their journey towards the World Pharmacist Day celebrations, and attending this is also giving them points towards the university. So you can just tell us whether you're a pharmacist, where you're joining us from, and if you're a student, which university you're from. Thank you.
Hey, Hezron. Hello.
Hello, Dr.
Yes, are we good to go or we continue waiting?
We're just giving a few minutes to have more members joining in, but then I think we can get started.
Probably
Yeah.
you can start by introducing
200.
the speakers
Yes,
as we wait, right? Okay.
that's okay. So good evening, members. Today we're going to have a webinar on medical errors, and that is part of commemorating the World Patient Safety Day. And I'll take you through just a few of the ground rules and announcements. So first of all is to thank you for participating in this session. All participants are going to be muted during the entire course of this session, and all questions and answers will be responded on the chat or the Q&A section. So for all the PSK members, if you have not already done so, please subscribe on the portal for this session so that you can get your CPD points. And the video will also be recorded and be made available on the PSK YouTube page. So now I'd like to invite Dr. Aniz. Dr. Aniz, maybe you could just briefly introduce the session and the speakers who will be having today.
Thank you very much, Hezron, and very good evening to all the pharmacists and pharmacist wannabes. We're so happy that you are able to join us today. I have a very distinguished panel with me today. We have Dr. Christabel Kayamba, who is the head of pharmacovigilance at PPB, who will be giving us her opening remarks. Then we have Dr. Jayesh Pandit, fondly referred to as the father of pharmacovigilance, give a bigger introduction when it is time to speak. And then we have my very good friend, the oncology pharmacist at Kenyatta National Hospital, Dr. David Wata, and a champion from a county that is leading, is one of the leading counties to do with pharmacy practice, pharmacovigilance expert from Kilifi County, Dr. David. And last but definitely not the least, representing the Kenyatta University Teaching and Referral Hospital, Dr. Christine Mulwa. So without very many words, I would like to invite Dr. Christabel to give her opening remarks. Dr. Christabel.
Thank you, Dr. Aniz. Good evening, everyone. Thanks to you all for taking time to be here in this session. So as we are aware, on 17th of this month, we celebrated the World Patient Safety Day. And the theme for this year was medication safety, and the slogan, medication without harm. So it's important for us to appreciate that medication safety has been with us for a while. Looking back at the history of medication safety, which goes back to the year 1937, when the first encounter of medication problems was documented regarding the contamination of sulfonamide elixir with diethyl glycol, which led to the death of about 105 people. And this led to various steps being put in place. For example, followed up in 1938, where there was the setting up of the federal department, that is the FDA. That is how it came into being. So when we talk about medication safety, we look at all the harms that are likely to occur with the use of medication and how to mitigate them. And one of the key issues around medication safety is medication errors. And we know that medication errors are one of the most common leading causes of adverse events. And we also know that almost 70% of all the adverse events that occur with use of drugs are actually preventable. So in line with this year's theme, it calls for us all to work together as various stakeholders, looking at healthcare workers, looking at the patients, looking at the regulators, looking at even the teachers in academia, and not forgetting the patient. So as Pharmacy and Poisons Board, which houses the National Pharmacovigilance Center in Kenya, there are efforts that have been put in place to ensure that we mitigate these adverse events or medication-related problems that occur. And in line with this, we have systems that have been put in place to help document these medicine-related problems, which include adverse events, medication errors, therapeutic ineffectiveness, adverse incidences that occur with use of medical devices, incidences that occur with use of blood during blood transfusion. So this is a very welcome webinar, and I'm looking forward to us all having interactive sessions to see how we can work hand in hand to ensure that our patients are safe. Because as we know, medicines are double-edged swords. They can do good, but they can also do harm. So we have the power to ensure that we minimize this harm as much as we can. Thank you so much and welcome to the session. Thank you, Dr. Anis.
Thank you very much, Dr. Christabel. I would like to start this webinar with a test. So I will ask Ezron if you can please share the first set of questions. This is a medication errors webinar poll. For the benefit of those of us who left school more than 5 years ago, I will read the question and please pick one answer. And we will, towards the end of the webinar, we will answer these. We will look who has got the most points. And if you win, then you will be given a present by Dr. Jayesh. So the first question, medication errors can occur at many steps in patient care, from ordering the medication to the time when the patient is administered the drug. At which stage are the most errors? So pick your answer. The panelists, sorry, you can't take part in this. It will be called rigging if you do. So we are not going to allow panelists to take part. Okay, let's go. The next one, we say the next question. I hope everybody can see the questions. Please answer them as you go along. Who is to blame for the most medication errors? One choice. Is it the medical doctor, pharmacist, farm tech, nurse, patient, or administration? Now don't all of you go and answer farm tech at the same time. The third question, the most common system failures causing medication errors occur due to, and the choices are inaccurate order transcription, drug knowledge dissemination, failing to obtain allergy history, incomplete order checking, mistakes, the tracking of the medication orders, poor professional communication, unavailability, or inaccurate patient information. Please forgive me if you're a student. I know in your 5 or 6 years you never learned these things, but now today we will teach you. Question number 4, what is the most common type of medication error? Is it prescribing, omission, wrong time, unauthorized dose, improper dose, or wrong dose prescription or wrong dose preparation? Question number 5, which of these is the most common administration error? The incorrect route of administration, giving the drug to the wrong patient, extra dose, and the wrong rate. Question number 6, which of these monitoring errors is not done by the pharmacist? Failing to take into account patient liver and renal function, failing to document an allergy, drug interaction with other drugs, drug interaction with food, drug interaction with disease. Number 7, which of the following is the most prevalent medication error? Is it due to an expired product, incorrect duration, incorrect prescription, incorrect strength, incorrect rate, incorrect timing, incorrect dose, incorrect dosage form, incorrect patient action, or a known allergen? Question number 8, errors by pharmacists are usually judgmental or mechanical. Which of these judgmental errors is the most common? A failure to detect drug interactions, inadequate drug utilization review, inappropriate screening, failure to counsel the patient appropriately, inappropriate monitoring. Question number 9, a mechanical error is a mistake in dispensing or preparing a prescription? Which of these is the most common? Administering an incorrect drug or dose, giving improper directions, dispensing the incorrect dose, quantity, or strength. And question number 10, which is the most common distraction for the medical doctor? Is it examining patients, ordering labs and imaging studies, not peeking but speaking to consultants, rounding on their patients, speaking to patient family members, or conversing with insurance carriers before ordering the studies? So answer these questions as you go along, and at the end or towards the end of the webinar, we will look at what people have answered. So Hez, if you can just share my first slide. Hezron, if you can share my first slide, please. Great. So as an introduction, this slide basically talks about the answer to how we can ensure that we work as a team and that everyone works towards best patient care. That is our aim. Our aim is to care for the patient in the best way possible. As we go along, you'll realize I don't read slides. So those of you who want to really take on the whole bit, you can read it, or you can see it later on on the YouTube page. I want to take the time now to introduce the first speaker. The first speaker is Dr. Jayesh Pandit. He has been in pharmacovigilance for a long time, and he is going to talk to us today about medication errors. Dr. Jayesh, over to you.
Thank you, Anis. Very good evening to everybody. A huge pleasure and honor to be with you all today, especially as we are still within that week of celebrating patient safety. So allow me to jump in. Yes, there is a prize that Anis had mentioned. So please do answer to the best of your capacity. And once the latest iPhone is released into the country, the next version, I will be happy to send you a picture of that phone so that you know which one it is on the market. With that, Hezron, next slide, please. Now, where I have been asked to come in is to talk about common medication errors. And when we talk about medication errors, it's important that we first look at where they come from. Why do they happen? So if we look at that procedure, then the linear sequence of drug use is what comes to our mind. So let us all step back. You and I are pharmacists. Let's step back. What happened to the patient before him or her came to us? So the patient underwent a diagnosis, right, with the relevant healthcare professional. A prescription was written. The prescription was processed, right? And that prescription we dispense. You and I, we dispense that prescription, right? And upon dispensing, there is medicine that needs to be administered. So there is medicine that needs to be administered, and the patient receives the medicines, hopefully gets well, and I use that tongue in cheek, hopefully, because we all know as much as all medicines are meant to do good, they are double-edged swords. They can do good and they can also cause harm. So the patient is intended to get well. Now, that is the typical sequence that comes to my mind when we look at patient safety. Next slide, please. So when we look at patient safety in terms of medication errors, then you can see that we have a lot of errors that can happen in different stages of the linear sequence that we followed. I'm not sure why the slide is playing around over here, but if you see within the three broader classes, you can read for yourselves the various sub layers of potential medication errors. Whether we say it's a wrong patient, whether we say it's a wrong drug, it was written wrongly, it was dispensed wrongly, it was a wrong route, wrong dose, etc., etc. But as much as you see all this, there are different papers that classify these in different ways. To keep it simple today, as we got medication here, I want to summarize that the typical medication errors happen across three broader classes. So you have prescription errors, right? So you can have errors at the time of prescription. You can have errors at the time of dispensing the medicines. And you can have errors at the time of administering these medicines, right? So let's keep these in mind as much as we see the different aspects that's ongoing, all right? Next slide, please. Now, if you look at medication, the first part that we saw about prescription errors, then in prescription errors, something that immediately came to my mind was a bit about handwriting. And we all know how wonderful the handwritings of our very dear doctors can be, and which, as much as we all know, pharmacists are in the best position to interpret what is written, but that is where an error can potentially happen and you and I get blamed, right? So if you look at this here, as much as it's perhaps a Mont Blanc pen and beautiful handwriting, but it is illegible. And you can see where a patient with depression was given an anti-anxiety medicine rather than the antidepressant, right? And below that, you can see, I wish this was open for a discussion, but if you read, the first thing I hope that comes to everybody's mind is 60 regular insulin now. But actually what was meant here was 6 units of regular insulin to be given now, right? So you can see this is where there are typical issues that come in. Next slide, please. All right. Then what came to my mind immediately was lookalike medicines. Now you can see here two very similar packs kept besides each other, right? And as much as pharma companies like to brand themselves and make sure that their medicines tend to look alike, at the pharmacy level, this brings in a level of dispensing errors where we might dispense one for the other. So instead of simvastatin for cholesterol, we'll give an SSRI like sertraline. And then you can see the two packs on the left, and on the right are two ditto brand names, right? Both are Medzol, and one is midazolam, whilst the other one is a PPI, pantoprazole, right? Next slide, please. So if these are lookalike medicines, you can see what came up in my mind again here, where as much as the secondary pack, the outer pack, shows very well labeled adrenaline, aminophylline, dexamethasone, and furosemide. But imagine if you are in theater, in the ICU, where all the ampoules are kept under one dispensing tray. Those ampoules, if they are not very well labeled, the nurse or the clinician there can make a potential error. And this can also happen to you and I in our pharmacy if we don't have a formal way of keeping our medicines. Next slide, please. So if I jump to the next slide, then you can look here on, that was look-alike medicine, then here we have sound-alike medicine. So they are also jointly known as LASA, look-alike, sound-alike. If you look at sound-alike medicine, then look at Clavix versus Plavix. Now, yes, somebody might argue that, Jayesh, this is not that big an issue. I agree, because essentially the API in both is clopidogrel 75 milligrams. But remember that this can cause a problem, right, in other medicines. Now, I give you an example of Lamisil versus Lamictal, right? One being an antifungal, the other one an anti-epileptic. Ketorol and Ketoral is what I remember from my previous practice, right? Where Ketorol is ketorolac, the brother of diclofenac, and Ketorol is ketoconazole and antifungal. Similarly, you can see that we can have issues with antibiotic sulfadiazine versus sulfasalazine, which is a disease-modifying anti-rheumatic drug. Next slide, please. So as you keep this in mind, the next broader class that I had highlighted was admin error. And in administration error, you can see that a classic point is, and these are the, right? Small errors which go unnoticed. At times they don't mean a big thing, but they have a huge potential to cause harm. So here you can see 1 million units of IU versus 625,000 of crystalline penicillin. Timing was different. So you gave your Lasix injection at 4 p.m. instead of 12 noon. Typically, we know we give this BD. It's given in combination with other medicines, so it's supposed to give a add-on effect, but this is missed out because somebody forgot this. Likewise, you can see when you and I don't document, right? The nurses don't document. So if somebody's already been given a medicine and you fail to document, then there is a potential that you will come back and cause another dose to be given. Next slide, please. Right, so you can look at another, I would say, a very sad administration error where chlorhexidine ointment, which is typically given, right, for the baby who is born, and the cord has been disconnected from the mother, then it is given there as an antiseptic, antibacterial, and because it is looking like a small tube, and we know babies born, sometimes they have the crustaceans in their eyes, they don't want to open their eyes, crying, etc., etc. There are admin errors where this chlorhexidine ointment is given into the eye, and it causes irreversible damage, as you can see through this picture. So mine is to ask everybody, let's keep this in mind in your and my daily practices. At times they go very subtle, right? But remember, they have a potential of causing harm. So next slide, please, my last slide, where I can tell you we have cases where the likes of Dr. Anis might be prescribing, and you can see this. This is something that's beyond me as well, right? Where you can see post-treatment certification being given to a patient where he or she, this I understood was from Botswana when Anis was practicing there, but prescription of a headache due to stress. And for the headache, he was prescribing that the patient gets 2 weeks off. So with not much ado, I would like to again lead you to some more presentations. Next slide. Some more in-depth reading that you would have. So there's a lot of information out there. Please look at these. I hope they are of added value, but I also hope that today, through my presentation, we have seen a broader perspective of medication causing harm. And now let's go a little deeper to understand what can we do to address these medication harms. Thank you so much. Over to you, Anis.
Thank you very much, Dr. Jayesh, for that insightful presentation. Can I ask Hezron to, yes, thank you very much. If you can share my, if you can just share my slide, please, Hezron. Okay, for those of you who joined us late, you can still go to the polls, and there are questions there. There are like 10 questions there, which you need to answer. So you can keep on going back there and answer the questions if you haven't already. We will discuss the answers at the end of the presentation. Next slide, please. So for those of you who live in today's world, you all know about the occasion that we had yesterday. And I want you to read this next slide. It really puts things in perspective, how we can watch Netflix and chill for like 3 or 6 hours and have no problem with that. Somebody will wait an hour to get served at KFC, but when they've come for their medicine, they're in a hurry to get served. But the kind of work we put into that prescription ensures that we don't end up in that coffin box. So our next speaker is going to talk about how to reduce medication errors. I hope I've got the sequence right. And this is going to be presented by Dr. Wata. Dr. Wata is the pharmacist, oncology pharmacist at Kenyatta National Hospital. So welcome, Dr. Wata.
Good evening, everyone. Thank you, Dr. Nils, for inviting me for this session. And thank you all for even just coming to attend as we celebrate this special day for pharmacists. So as we look at medication errors, first of all, I want to thank Dr. Jayesh for doing the presentation he did. Actually, I had done a few slides which were trying to describe some types of medication errors, but he is done way better than me, so I won't talk about those. I'll just look at some of the methods, some of the techniques we have tried to put in to just minimize medication errors. As Dr. Niza said, I work at Kenyatta National Hospital in the oncology department, and so I would give a few techniques from the oncology perspective and from the hospital perspective, but I'll also try and discuss about what you can do even in the community perspective. So we can go to the next slide. Okay, so we'll talk about minimizing errors. So there are all these things you can do to minimize medication errors. And I like the way Jayesh just presented on where all these errors can occur, but I will just emphasize on a few of them. Meanwhile, you can, as you can see this slide, this just talks about the basics. So about automation, about standardized order sets, about independent double checks, continuous education like what we are doing today. This should be aware of lookalike and sound-alike drugs, and track medication errors and communication with the prescribers. So I'll need to keep coming back to this, but you can go to the next slide. Next slide. Okay, so we'll just look at the differences between the hospital pharmacy and community pharmacy practice. Just go to the next slide, please. Next, okay, yeah. So Dr. Jayesh showed us some of these prescriptions, and I'd like to just bring these prescriptions here so that you appreciate them again. You can see this prescription clearly. There's nothing much you can see over here. This is one from this is from a hospital, and this is also from a hospital. So this one here is an oncology prescription. So you can see the way it's been written. So it's a bit more legible than this, definitely. But still, this is not perfect. So in terms of prescription, let's go to the next slide. So this is called a standardized order set, and this is what you're using for oncology nowadays, especially the pediatric oncology. So you can see for the patient, the regimen is clearly written. So this is printed out. So the medicine, the doses. So what the clinician has to do is just to put the name, the age, gender, the height, the weight, calculate the body surface area, put allergies here, and put the name there and date it. So everything is over here and the dose is over here. And of course, this one is for a specific diagnosis. So I think this thing cut the top, but here is on top here is written acute lymphoblastic leukemia. So when you receive this at the pharmacy, you know you have all the details of the patients. That is one. So you're able to know this patient has this particular diagnosis, and they are on this treatment journey, and they're supposed to get these medicines. And now you can track how they've been receiving this medicine. So for example, if the patient is at this point, day 29, you'll be able to see how when they got these other doses of medicines. And so if there's a particular error, for example, in terms of the scheduling, in terms of the date, in terms of the dose, then you're easily able to correct one because you know the diagnosis, next you know the dose, you know the details of the patient, such as the weight, the height, and the body surface area, which you're using to calculate the dose. For this one here, which is given according to age, since you also have the age over here, then you know the exact dose that is supposed to be given. And as such, you're able to ensure that, at least for this particular patient, where this order has been brought to your pharmacy, they get exactly what they're supposed to get. And in terms of minimizing errors, this one is able to reduce your prescription errors, and your dispensing errors. So at least you're able to minimize those two. And also in a level, you're able to reduce the administration errors, because for this, when this order comes to the pharmacy, then the medicine is prepared in the pharmacy. From there, there is counter checking, and it is dispensed now to the administration area, now ready for administration. So, for example, this one is supposed to be given orally. It will be given orally because you've seen it in the order set, and the label will be printed again also to be given per oral. This one is supposed to be given in intramuscular, and as such, it will be prepared as such as to be given in an intramuscular way. This one is supposed to be given intravenously, and it will be prepared in a way that it will only be given intravenously. So just by using this particular order set, you are able to minimize some of your prescription errors, your dispensing errors, and also your administration errors. Now, I agree this is very applicable in oncology, and it may be very difficult to apply in all other areas, but it can be applied in a few other areas where you have high alert medicines. And so when you talk about high alert medicines, you're talking about medicines which, when an error is committed, is likely to be very fatal. So in some of the high alert medicines, you're able to actually use this. In some of the chronic disease management, you're able to use this. I agree. I know definitely, for example, in a community pharmacy setting, this may not be practical, but at least in a hospital setting, for some of the disease areas, this one will be very applicable. Let's go to the next slide. So this is something that Dr. Jesh presented something similar, but I just wanted to show you some of the things that can be done to minimize these errors. So you can see, for example, this enalapril 5 mg and enalapril 10 mg. So it's easy to confuse because the colors are very similar. And when you are especially working in a high volume area where there is a lot of work and there's high pressure, there are very many patients waiting. So you need to be working very fast, then it's easy to make an error. And so for this reason, one of the things you can do is print out some stickers. So one of the things we've done is that we printed out these stickers written look alike and sound alike. And this is supposed to act as a warning. So when you look at a medicine pack and you see this sticker, then it's supposed to trigger something in it to confirm that, to ensure that you actually confirm the medicine that you want to dispense. So it's been done for this and it's been done for this. Now, of course, in a high volume area, you need to put many of these labels into very many of these packs. And so you need a lot of help. It's actually a lot of work putting these labels. But another method that can be put, which I didn't manage to get the pictures, is have like a dispensing area where there's a much bigger label or much bigger sticker written look alike and sound alike. And so when someone goes to that area to remove that a particular medicine pack from that, the first thing they see is look alike, sound alike, and therefore something is triggered in their mind, and they'll stop and confirm, okay, what is this, before they dispense. So they can take time, instead of just picking the medicine, they can stop and look and confirm, then dispense. So that's the idea of putting these labels on these packs or on your drawers that have where you store your medicines. Something else that you can do is, though it is also cumbersome again, is remove your strips from the packs and insert them into your Ziploc bags. So when you do this, then it will not be the color that triggers, but so when you do this, then you'll be forced to actually come and look at the strips and confirm the drug that you have before dispensing it. Again, this is cumbersome. It requires a lot of manpower, but it will help minimize your errors, especially for the look-alike and sound-alike medicines. Next slide. Okay, let's go back. I just emphasize a few things. Let's go back to the first and second slides. Back. Again, back. Okay, so just looking at this. Okay, let's go to the next slide, please. So we've talked about the standardized order sets. The other thing we can do is implement a double check. So this one will require an extra staff. I know in many cases this may be difficult to achieve, maybe in the smaller hospitals. In some government hospitals, it may be difficult to achieve, but this is something that you need to enforce. Something we are planning to do is in KNH is try to just enforce a kind of double check before all medicines are dispensed, then try and collect this data. Once you have the data, then we can try and submit this data to the management so that we try and prove the value of having an extra pharmacist to just do a double check and thus minimize the errors. The other aspect is communication with the prescribers. Again, in hospital, this may be easy. I know in community, this may be difficult because prescriptions come from all over the place, and you in the pharmacy, you may never know. The prescriber may not have put his number over there. So it might be a bit difficult, but this is something that you, as pharmacists, we should really try and see if you can implement just that idea of communication with the prescriber so that you sort many of these errors. I know where I work, when you open that communication channel with the prescribers, they get to appreciate you, and they'll always be ready to clarify anything that is unclear. And this way we will reduce the medication errors. Next slide. So there's the next slide, please. So I've talked a little bit about reconstitution of high alert medicines in the pharmacy. So this one will require extra facilities. In your pharmacy, you may need to have like laminar flow hoods, or if you don't even have those, you can provide some quick guides on reconstitution and administration of medicines to the nursing staff in the ward, so that they're able to do reconstitution, especially the addition of some high concentration electrolytes, which they may not understand very well. It's important to provide some of this information so that people are able to do the correct dilutions, the correct and the correct administration. And also, just as a last item, is confirmation of patient and patient details before dispensing. And especially in high volume areas, this is very important. If you have very good IT systems where you use barcodes and things, then this is minimized. But if you're calling out names and you can't read the prescription very well, instead of saying Mary Wangara, you say Mary Wanjiru, then it's really easy to confuse the patients. And so if the patient comes, then when the patient comes to the window, then you need to call out, ask the patient, is this your prescription? Is this your name? So that you're able to just confirm that patient and ensure that the right patient gets the right medicine. As Anis had said previously, when people go to KFC, they are ready to wait for 1 hour to get their food, but when they come to the pharmacy, they are always in a rush. But it's important to just try and slow people down and confirm all details before we dispense the medicine. So I think from my end, that is what I had to say. Thank you very much.
Thank you very much, Dr. Wata. I think the moral of the story is don't name your child Mary. So for those of you who don't know, Jayesh works in a drug and poison information center. And of late, he was getting a lot of emails and messages about counterfeit drugs coming into Kenya. So apparently some medications are being sold that are made in the backwoods and factories in many third world countries. So the latest message he got was from PPB was to say, look out for counterfeit Cialis from Venezuela. They said if we are going to be dispensing Cialis, we want to make sure that it's made in Kenya, because the last thing we want is Venezuela interfering with our elections. The poll questions are still there. You want to go to the poll and answer those questions, because they will only be there for the next 2 or 3 minutes before we go to some more questions. And we now go to our next speaker. Our next speaker, I don't even want to try his name, because if you pronounce my second name, is Srinivasan Kalyanan, and I don't want you to try that, so I'm not going to try with that, Dr. Olunga. Please go ahead.
Okay, thank you so much, Anis. You're such a hilarious guy. What's that about the elections and the elections? Are they one and the same, or they're different? Okay. So I want to thank Dr. Wata so much for that very elaborate presentation. Actually, you're sharing with us real life situations like in our work environment. KNH is a very busy hospital, and I can imagine the amount of workload you have there, and getting time to share with us the real situation within that hospital is very wonderful. It's a privilege for us to learn from you. Dr. Jayesh, the father of pharmacovigilance, It's also always good to share a platform with you. Thank you so much also for getting this time to share with us. So I was given a simpler role. Now that the 3 speakers that have spoken, actually 2 that have spoken before me, have already elaborated to you very well on how you can be able to identify medication errors and how can you be able to classify them and all that. So you have had a good discussion. So mine is simple. I would just like to take you through how you can be able to report them. So Dr. Niz had shared with me another form, actually it's a Google Docs form that actually probably they use in their private practice to report medication errors. But I would like to restrict myself to what we have as a country. As a country on the PPB web portal, we have what we call if you log in into the www.pharmacyboardkenya.co.org, you'll be able to go to the pharmacovigilance portal where we are able to report our cases. So we do use a document that I would like to disclose in a while. Sorry. Next slide. So you can see that gentleman is very much worried about something. Probably they have just discovered that there is a problem somewhere. Someone has received a wrong pill, or someone has been given a wrong medication. Someone has had some harm, and they were worried what to do. So I will just like by alerting my fellow colleagues and students and all who are listening that the role of reporting is not really to point fingers, so that you can say who is at fault. No, we are not for that. Actually, we just like to highlight the gaps that we do face within our service delivery points. And actually reporting also helps us to be able to inform policy. We talked about lookalike, sound-alikes, and all those kind of imports and just be manufactured and packaged within this country. So always PPB can go back, and if we can be able to identify a number of errors that actually some of them are near fatal, or and some are actually fatal, we can be able to put a policy change that can be able to address this. Then it also helps us to highlight the errors that we are much more prone to doing in our service delivery points. For example, if you are handling anti-cancer meds like KNH, some of them have a really narrow therapeutic window, and if you mess with the dosing or you give someone wrong medication, you can simply end up causing a problem in their lives. Next. So here we have a platform. A platform that we do use to report from the PPB. There are actually 3 ways you can be able to report this. Number 1, you can do it physically by getting the blue form. It's called the blue form in short, but it's the medication error reporting form. It's blue in color, it's color coded. For those of you who have been to the PVAS portal, we actually have a set of 6 tools that are there in soft copy that you can be able to log in after you have created an account. You have to get an account, and then just simply by logging and following the simple steps, and eventually you have your account activated. And then you can be using it to access these mini forms. You have the yellow form for reporting adverse drug reactions. We have the pink form for poor quality medication. We have the white form for AFI reporting. That's adverse event following immunization reporting. We have the off-white form for reporting blood transfusion related problems. I have the green form, and now we have the blue form. So this time around, I'm going to focus on the blue form. So 1, you can have it physical, and actually you can get it from your pharmacist, especially at the county level, and even at sub-county level, because we have these forms in soft copy that are available. You can be able to print a hard copy from that soft copy, then you can fill it physically, and of course you can always hand it over to someone who can be able to upload it on your behalf onto the portal, because that is the easiest way of communication. And if you were much more IT savvy, you'll go to the app. We have a mobile app where you can download it on Google Play, and this mobile app, you install it on your phone, just like you install Facebook on your phone. Then your phone will become global. you can be able to give reports. You can, after you have installed it properly, you can be able to go to whichever form that you want among the 6 that I just named. Then you can be able to make a proper report. But in case you're using a Mulikamuis or something like that, there's this *271# that you can also use to reach out, but it's not a detailed form. It's meant for the public, where you can be able to give a simple report. But when you look at medication errors, most of the time, the people who will be reporting it are actually health workers. But all these avenues that I'm talking about lead to the blue form. You have to give information about the blue form. If I had time, I would have gone through the form in detail, but I've summarized in the next slide. Yes, next. So the most convenient, of course, is the World Wide Web, whereby, as we said, once you have, if you log into pv.pharmacyboardkenya.org, the website is down there. You can see it. You can be able to create an account, or if you already have an account, you just log in, and then you will navigate to the relevant tool. They are color coded. You can see the yellow form, which is SADR reporting form, the white form, AFI reporting form, the pink form, which is poor quality medication reporting form, the green form for medical devices. We have the blue form, and then the off-white, which is transfusion reactions reporting form. So all these tools will be at your disposal once you log in and you have an account, and you can be able to fill it out. But even for members of the public can also utilize the same portal and report without having to register. Then they can be able just to give the minimal details that they can be able to report, and it will reach the Pharmacy and Poisons Board. Next. So the soft copies of these forms, of course, are available, as I said, and you can have them printed, and then you can fill them. If you're still analog, that is, but which you are discouraging because of having them. Sometimes when you mail a lot of forms, a lot of reporting tools to PPB. I have been to that office directly, and I've been invited with Dr. Haemba and her team. Actually, it's a huge pile of forms that have to be now input into the system manually. So if you mail it, you can still use this address, Lenana Road in Nairobi, and they also have a customer care number that you can be able to follow up, which is 0795 74 30 49. This there on the screen. But the most ideal one would be for you to upload it on the PVAS portal, because that is instant. And once you upload it, you're going to get an acknowledgement that you have received your report. And in case there's going to be any follow-up, you still communicate through your email address. It makes it easier for work to be done. Next. So for online reporting, once you have logged in, of course, you'll navigate to the relevant form, that's the blue form, and you'll just fill it accordingly. And then you will be able to, the portal will generate a code. Yeah, this code will be emailed back to you so that you can always follow it up, maybe A001 or something like that, that can be used for future referencing if it's necessary. Because some of the medication errors can be serious, and if they are serious or they're common, we can be able to track them and be able to see where we can be able to obtain more information and details as PPB, and then it can inform a policy change. Next. So that is the blue form. You can see. First, you have to identify the facility where this is occurring. For those of you who are working in private hospitals, public hospitals, and even clinics that are registered, all facilities, health facilities in Kenya have what we call the master facility list number, MFL numbers. All of them, whether you're private or you are GOK. Yeah? So those numbers are there for a reason, so that we can be able to access facilities, we can be able to geomap them and know what is happening where. So once you identify, we have to identify that facility appropriately. Of course, you give the name and things like that. And then you have to identify the patient that is affected. Probably if the error has reached a patient, you can be able to identify this patient using initials. You avoid giving names, yeah, because you want to maintain that confidentiality. Then, of course, you describe the error and the harm whether it is the patient or not. Then you describe the product that is involved. Then you can be able to recommend some remedial action, or what can be done to be able to correct it. And of course, you'll give your contacts. That's a snapshot of the blue form. You can see on the right hand side of your screen. And if you go through it, there are much more details. Where, for example, if the error occurred during this prescribing, whether it's a dispensing or administration of the medication or any other place, probably it can be the patient had gone home with the medication, and probably it can be an accidental kind of ingestion or something like, or a lookalike, whereby the patient confused one medication for another. Then you also look at the outcome. Yeah, sometimes there's no harm at all, but sometimes actually harm does occur, or sometimes a patient might end up being hospitalized because of this. Yeah, all that you have to describe it. When you get the actual form, it's much more detailed, and you can be able to see that actually almost all fields have been taken care of. Yes, next. Next. So thank you so much for your time. And I would like to hand it over to the panelists.
Thank you very much, Doc.
Yes, thank you.
I am very happy that we shared these reporting tools so that all 600 plus of us will know how to report errors and build the database, because one of the challenges we have in this country is of getting data to be able to do effective local work. We still read reports from the US or from the UK to say these many percentage of medical errors, but it will be good over time to have our own set of data so that we can be quoting our own data. Those of you who are asking for the slides to be shared, they will to be emailed to you. That will not be done. You will be able to access it on the PSK website. It will be uploaded in a few days, I think, and then you'll be able to access the whole presentation on those slides. For those of you who have not, we are going to go now to the next set of questions. So, if this is the second poll, the questions are: which distortion causes the most medication errors? Poor writing, misunderstood symbols, use of abbreviation like PO, improper translation. The second one is: which of these medication errors related to your employees is the most common in your setup? So if you work for an institution, which of these is the most common? Is it negligence, forgetfulness, hurrying, poor motivation, vengeance, or carelessness? The third question: what is the best course of action to take when faced with a medication error? Is it blame and shame, or is it loss of privileges, or the threat of a medical malpractice suit, or relieving them from certain duties, transfer to another department, and understand how the system failed? I wish this question was about university. Which is the best course of action to take when faced with a poor professor? Anyway, going on. The next question 4 is: which of these skills should a pharmacist use when communicating with the prescribers or with the nurses? Outline the problem and then provide details. Offer possible solutions, including substitute medications. Repeat back the order or order changes. Confirm your understanding, and document the conversation and decision. And question number 5: which is the most common result of a medication error to the patient? Is it that they increase in hospital stay, increase in cost of medication, increase in adverse drug reactions, or increase in an adverse drug event, or decreased compliance? And the last question: true or false? Adverse drug reactions are expected negative outcomes that are inherent to the pharmacologic action of the drug and are not always preventable, while Okay, we missed out something there, but maybe you can see it on your system. You will answer true or false. So that poll will now go on till our next for our next speaker. At this point, I would like to thank our next speaker for stepping in. She has been coerced, I should say is the word, to doing this presentation at a very last moment, because she told me that Dr. N is cute. I didn't know what being cute has to do with her doing the presentation. Maybe she'll clarify why she told me she was cute. So Dr. Christina, please carry on your presentation.
Thank you, Anis. I'm Christina. I work at KU TRRH. I'm making this presentation on behalf of Dr. Anne Mercy. So we've had very good presentations, and they've basically introduced the types of errors, medication errors that we expect, or the medication errors that we experience in our various places of practice, whether it's in the hospital or community pharmacies. Dr. Jayesh has widely talked about the types of medication errors and will not dwell on that. Dr. Wata has given an elaborate presentation on how to minimize medication errors. Dr. I'm also not going to try to pronounce that name, as Dr. Anis has he's not been able to pronounce it, but Dr. Olungo, allow me to use your second name, has given us a presentation on. Thank you, Doc. A presentation on how to report this, and especially nationwide, and what we are doing as a country. So for my presentation, I would like to further elaborate on how we can empower patients to ensure medication without harm. And it's one of the ways to reduce the medication errors. You can move to my next slide. An informed patient is basically an empowered patient, and this patient will be able to assist in ensuring that we reduce medication errors. Research has shown that purely just giving patients information, this can reduce and intercept up to 3% of the medication errors that we've gone through. So when we talk about an informed patient, and the today's patient, you'll agree with me that this is a patient who comes to your hospital, to your pharmacy with a lot of information. We are in the digital era, the era of information. People are looking for information everywhere. People have Google, and they're reading all kinds of things. So the today's patient is an informed patient. And our role as pharmacists is to ensure that the information that this patient has is the correct information, and the information, especially now about medications. They have the medications that they need to empower them to ensure that they are taking their medications correctly, and that we avoid these medication errors. So majorly the patient, the sources of information that these patients will have will be maybe the physicians they are seeing, the doctors, nurses, when they're dispensing their drugs, or when they're discharging patients. Patients will also look at drug labels, and some will even go to the extent of looking at the inserts, and they will also ask other people, have you taken these medications? Give me some information about these drugs, etc. Google, of course, leading that. But the point that I want to focus on is on the pharmacists and the pharmaceutical technologists. You are the last point before the patient goes home, whether it's in a pharmacy or in case it's in a hospital, you are the last point. And the patients will probably remember what information you've given them. And you are supposed to empower these patients to make sure that when they take these medications, they're going to take the medications correctly, and as prescribed, as ensure that these drugs are stored in the correct manner. So how do we do this? How do we as pharmacists and pharmaceutical technologists empower our patients, give the patients the information and give them the tools that they need to ensure that they are taking their drugs well? Here's next slide. So this is basically what I've said, that when the patient is leaving, you're the last point. So the information that you're giving them, what drugs are they taking? What is this drug for? And when you're describing these drugs to these patients, you might want to use the generic names, and maybe some of these generic names are hard and difficult, but just mentioning to a patient, even explaining to them, there's this name, there's this generic name, this drug will be lowering your pressure, and explain to patients on their level, without a lot of technical jargon, to make sure that they understand and comprehend what you are telling them. So, and don't use the jargon, don't say they use this drug, this is amlodipine, it's used to lower your BP. Talk to them on their level, so that they're able to understand what the drug is being used for. How to take the drug. I'll not belabor on this, but when you're giving a patient or you're dispensing to a patient medication, make sure you give them information on how to use, and more importantly, also demonstrate. So say you have a patient with inhalers, you have to demonstrate to these patients how they are using these inhalers. For their asthmas, research has shown that a lot of patients who get recurrent attacks, etc., or asthma that is not well managed, is because of how sometimes the technique on how they are using their inhalers contributes. If you're dispensing insulin, you have to show the patients and demonstrate how you are going to administer or how they are going to take these drugs. If it's a powder, you're for instance, dispensing something like Montelukast sachets, you have to demonstrate to the patients and show them and explain to them how to take them. The side effects, basically, this is what the patients should look out for. You have to explain to them in a language they understand. Say you are dispensing cloxaxazone and then you tell the patient, maybe you will feel lethargy. Maybe the patient might not understand what that is. Explain to them how they will feel, and something that a lot of people forget is explaining to the patients what to do in case they experience those side effects. So if you tell a patient you might feel drowsy, so what does that information mean to that patient? You have to explain to them, don't operate heavy machinery. This is what it means for you. Maybe take this drug in the evening, or if you get such reactions, then you have to report to the hospital or to a healthcare worker, etc. So you make sure you tell them what to look out for and how to what to do once they've experienced that. So you also need to explain to the patients how you've labeled the drugs, how they are going to store these drugs. Dr. Jayesh shared a very good slide on lookalikes. If drugs are lookalikes, how this patient is going to identify them at home and make sure that they don't take medications different times or the wrong way because these drugs look alike. So in the case of storing medications in different packs for different patients, and this applies a lot, especially for mothers who have, say, like 2 or 3 kids, they're all sick, they have all been given medications. Make sure that these drugs are stored, or you give them information that they should not share the drugs, and each patient gets the different their medications. So next slide. this is the focus of my presentation. All that information that you need to give to the patient or empower the patient to basically have the capacity to take their medications correctly and avoid errors. There are some tools that as a pharmacist and you should be able to expose your patients to or have them use to assist them in empowering them in correct drug use. One of the tools is having an updated medicine list. I'm not going to belabor on this. We just finished a series on MTM training, and part of MTM is medication reconciliation. There's the medication reconciliation tool that includes all the drugs that a patient uses, whether it's prescription drugs, all the OTC drugs, herbal supplements that the patient is taking. With that updated medicine lists on how what drugs the patient is on, how they are taking them. This is one of the tools that will empower this patient to be able to use their drugs correctly. Second tool is a weekly pill box. A pill box is basically a pill arranger where you're given some sort of a box with the pills with segments of the pills that you're supposed to take and what time. So you have a box, it's written Monday, Tuesday, Wednesday, Thursday, and then in between it has divisions showing morning, mid-morning, evening, and basically this is a tool that assists either maybe the caregivers for these patients or even patients who have multiple drugs. It assists them in knowing which drug is to be taken when. So when you're doing your medication reconciliation, this patient will just show up with the box, or where you are doing your dispensing, patient shows up with the box, and then you put the drugs in the correct in the correct sections for these patients. I've actually seen some boxes with brailles for the people who are visually impaired, that they're actually also empowered in their care and in the medications they're taking. Another tool is a patient alert card. Adverse reactions that the patients have had. So for patients with maybe say a penicillin allergy, they just have an alert card that when they go seeking for care or they come for to the pharmacies or to the hospitals, they have a card that shows, oh, this patient is allergic to this, and you can be on the lookout for that. The final tool is the WHO's MedSafe app. This is an app that has been developed by WHO to actually empower patients and to stimulate the curiosity of patients in the sense that what should patients look out for. So Ezron is sharing the app. This app is available on the App Store for the Google, for the Android users. It's also available on Apple, and this app is available for use by caregivers, patients, and basically it can be used at all levels of care. If you're giving medication, this is a tool that it's for the patient, that it gives patient information about medications, the medications they are taking, to ensure that they are taking them correctly, and empowers them to ensure that this medication does not cause them harm. But to fill this tool, they need assistance and guidance from professionals such as pharmacists, the pharmaceutical technologists, as you're dispensing this. So chances are the patient out there will not know that this app exists. It's upon you as the pharmacist, the drug expert, to expose your patients to this app, So as you're dispensing your medication, then you give information to your patients, explain to them there's this app that will enable them or give them the information that they need, the correct information that they need about their medications. And this app can be used at any of the 5 moments that have been identified by WHO for medication safety. There's starting a medication, taking how to take medication, when adding a medication, when reviewing any medication, and when stopping medication. Maybe we can go through one, but because of the time constraints, maybe you can go through the rest. Download this app, fill it for yourself, by yourself, and then when the next time you get a patient, you will be in a position to explain to them how the app works and how they can be able to input information on this app to enable them to take their medications correctly, to have their medications reviewed correctly, to basically stimulate and facilitate communication with their doctors and with their pharmacists. So maybe you can look at the one for starting medication. So when you look at the app, this is how it looks like. So the patient should have what is the name of this medication and what is it for. So when you click on that, it gives you, yeah, that is what it gives you. It gives you a place where you can type what the medication is. So say you are taking amlodipine, 10 milligrams. So the name of the medication, you are encouraged to assist the patient to fill this in a generic format and not using brands. We've had, I recently came across a patient who was using Abitel 80 mg and using Tell Me 80 mg, thinking that they are 2 different drugs. So if the patient knew that, oh, this drug is telmisartan, then they would see that they are taking the 2 drugs they're taking, they're just same drugs. It has a part where you can add a photo. You can take a photo of the drug that you're using. So what is it used for? To lower blood pressure. So you're explaining to this patient to write, the patient is writing for themselves, or their caregivers, they are writing for themselves, as this app will be for their own use to basically empower them to be able to have the knowledge to take their medications correctly. So what is this used for? You write for them there to lower blood pressure. And then once you say finish, that is saved. So it goes through a series of questions on which basically stimulates you on the information that you're supposed to give to the patient. So by the time this patient goes home, they have all the information that they need to correctly use their medications. So I would urge all of us to to make use of these tools that have been used, that have been made to our disposal, to make sure that patients, when they're starting medications, when their medications are being reviewed, when we are adding any medications, or when you are stopping any medications for these patients, they have all the information. Because of the time constraints, I'll not go through each of them, but if you have an Android phone, just download this app, go through all those questions that you should basically provide and assist all the patients and the caregivers with this information, and have them take this information home with them to enable them to take their drugs correctly. I would wish to stop there. Back to you, Anis.
Thank you so much, Christina. Just want to add 2 points about this WHO app. Last week there was a WHO seminar, and it was attended by more than, I think, 800,000 people online. And WHO have found out that this app used on patients reduces by close to 100% the errors and increases compliance by more than up to 100%. So this app has been shown to do the work that we are supposed to be doing. We might have challenges of technology or with understanding with elderly patients, but I think if we can embrace this free app, it will be able to help us to help our patient. The second thing it also helps with is that patients who go to many doctors and many pharmacies, if they have all their medication in this app, they can always show this to the doctor or the pharmacist to say, this is what I'm on, so that the doctor is also aware before talking to the patient that this is what they're looking into. So thank you, Christina, for that. I want to now open it up to a bit of a question and answer. But before we do that, let's project the results of the quiz and get Jayesh ready to present his prize. So, Ezron, we go question by question and look at the answers. Okay, so the first question, 37% of the respondents feel that most errors happen at the ordering and prescribing stage, but very closely followed by at the dispensing stage. All right, next one. Who is to blame the most? Wow, surprise, surprise. The pharmacist is the most to blame for medication errors over the medical doctor, and then all the others follow. I think we have a lot of text in this presentation, but anyway, let's go on. Question number 3. The most common system failures causing medication errors, poor professional communication being the most important, followed by unavailability of or inaccurate patient information. Good observations. I think we'll share this on the YouTube page so that people can use it, because we have a good size of respondents. Which is the most common type of medication error? Wrong dose prescription or wrong dose preparation. Okay. Next one. Which of these is most common administration error? The wrong rate. Okay. Interesting. Number 6. Which of these monitoring errors is not done by the pharmacist? I think this one you just picked the first one because you didn't really understand the question. But anyway, that is probably the right one. Failing to understand the account for patient liver and renal function. Which is the most prevalent medication error? Incorrect strength. Incorrect dose is the highest. Oh, interesting. Errors by pharmacists are usually judgmental. And which of the following is the most one? Failure to counsel the patient appropriately. Now we have the MedSafe app. We have the MedSafe app, which is going to help us to bring that to 0. A mechanical error, dispensing incorrect dose, quantity, and strength. That was an easy answer. Which is the most common distraction for the medical doctor? Is conversing with insurance carriers before ordering studies. Interesting. Okay, we will now go and answer a few questions before we go to the next set. I think the one that I can is Dr. Christabel, are you there? Have you seen a question? If you go to the Q&A tab, you can see a question which I think is probably best source for you is what are we doing with manufacturers who are making it is unfortunate that the manufacturer creates the lookalikes and then we try and look for ways to differentiate them. Why can't they just be intentional and use different packaging colors, etc.? I suppose they are not short of colors to use for different drugs or strengths. They make it unnecessarily difficult. Maybe you can take that question along with Dr. Jayesh, maybe. And then there's another question on what we are doing to educate the public to ensure that they fill in the app. So Dr. Christabel and then maybe Dr. Jayesh.
Thank you, Dr. Anis. So first of all, we appreciate there's a big problem of look-alike, sound-alike. And it's not just a Kenyan problem. I'll say this is a global problem, because when you look at it, these are issues that are coming out across the globe. But one of the biggest challenges, as Jayesh mentioned earlier, probably at the time of manufacturing of this product, or even when the companies were coming up with the packaging or coming up with different design, the assumption is the people who are handling these medications are professionals and are expected to be keen while giving the medication. But we appreciate, especially in the low middle income countries, that when you look at the workload against the number of personnel, it may not really be easy for them to have time to look at this medication and ensure that they are not exactly potential sources of errors. So one of the biggest challenge, if this is not documented, and the reason why PPB has come up with even the reporting platform is, yes, we've had people talk about it, that this has happened, but then when you look at the records, you find it is not documented anywhere. So when we get this data with documentation, you're able to put a case across, and even the companies, and tell them, yes, this is how your company is, but then there is a potential of error. We look at the risk-benefit assessment. Some of the example, like I'll give an example of the chlorhexidine chlorhexidine for cord clamp, which was being mistaken for eye drops. And this is something that was picked up together PPB with the eyes unit at Afya House. And also, because this is a case that had also been noted globally, we were able to take some regulatory actions, and the packaging of these the drops for the cord actually were changed. So that's why it's important that as much as we are putting measures in place, of course, we're supposed to have measures in place to minimize errors as much as possible. But how prevalent is this problem? If we are able to get the incidents, the incident rates that are occurring, it is easier for us to be able to talk to the manufacturers and tell them, yes, this is what is happening, but because of ABCD, we demand that this is changed. And when you look at it, as Jayesh was presenting, you'll find that in some places, there is what they say the Tolman letter syndrome, naming of drugs, where you can have look-alike drugs, but how they are named, it is easier for you to minimize the errors. But I'll also hand over to Jayesh to also maybe say one or two things from their end.
Thank you, Christabel. No, I fully agree with you in full concurrence. The most important thing, and we've got a follow-up question on that I've seen, that what are pharmacists in the industry doing about this? The point is, if you don't report, then both the industry as well as the PPB would not be aware. And if we are not aware, we can't do much. I have come across colleagues who have reached out to me previously when they said that, oh, Jayesh, this is what my company ABC has been written to. This is the complaint that we've received from the field, that one of our products is causing such medication errors. What do you think is the ideal way to sort this? So there are pharmacists who are willing to take this up. And that ideally comes down to the role of the QPPV, as we always refer to, the qualified person for pharmacovigilance, together with the regulatory affairs pharmacists, and they would work with the health authority in Kenya, being Pharmacy and Poisons Board, to come up with the ideal way forward to minimize and mitigate such risks. So takeaway message: if you come across medication errors, you had a medication error even though what we say, some being near misses, they didn't happen, you are lucky, but it could have happened. This is extremely important to report to Pharmacy Advisors Board, and then Christabel and team would pick this up. I hope that helps.
Thank you, Dr. Jayesh. I want to give a chance to somebody who has raised their hand, and just because I know her, I'm going to favor her. It's not nepotism, it's pharmacistism. So, Dr. Kusu, do you want to ask your question? Hezron, you allow her to speak?
Yes, Doc, I've just allowed her. She can unmute.
Dr. Kusu, if you can unmute, you can ask your question.
Sorry, Daktari, I actually do not have a question. Thank you.
Fake reporting. Maybe you take
Yes.
another one.
That's an error, medication error. Kusu error.
Kusu error. Hezron, give somebody else a chance.
I'm seeing we have Daphne.
Okay, another fake one. Okay, I think we're also getting tired. I want to take this opportunity. Let's just do the last 5 questions. The results from that poll of the last 5 questions before we close. Hezron. So as he's preparing the survey results, I want to take this opportunity to thank all our speakers for spending the time. Okay, there we go. Which distortion causes the most medication errors? Quite overwhelmingly poor writing. So we are going to recommend to Kenya, which board? What is their board called? Doctors, what do they call their board?
Medical practitioners, dentists.
Yeah, that one. Yeah, we're going to recommend to them they go back to BBC. What is that thing called? BCC? BBC. What is the new curriculum? BBC. Yeah, they go back to 844 and
It's CBC.
yeah, CBC. Yeah, they go back to CBC to learn how to write. Which of these medication errors related to employees is the most hurrying? Yeah, haraka aina baraka. We need to put that on our pharmacy walls. Okay, which is, I think this one, almost everybody answered it correctly, is best course of action to take when faced with is to understand the system, how the system failed. Now, if you translated that to your lecturer in university, by the time you understand the system, university will have closed. Question number 4, which of the following skills should a pharmacist use when communicating, offer possible solutions, including substitute medication? And then number 5, which of these common results is the most common problem? Increase in adverse drug reactions. And the 6th one is true or false. It was actually a definition which was true. So these questions are not meant to be right or wrong. They were just all examples of what kind of medication errors and the thinking that should go behind this. So I would like to thank the Kenya University Students Association for bringing such a big number of participants to today's presentation. And as you join us in our profession, we hope you will help to reduce the number of medication errors that we face as a country. I will give 1 minute, maximum 1 minute to each of our speakers to have the parting word. Dr. Jayesh?
Thank you, Anis. My last words would be medication without harm being the theme, as much as it is a theme. I hope whatever little that we have learned today, we realize that truly that theme is in our hands. So we as pharmacists, if we take this forward, we are surely going to make a difference, and the difference will be towards enhanced patient safety. Thank you.
Thank you, Dr. Jayesh. Dr. Mangongo? Oh, I did not follow order, but it's okay.
It's okay. It's okay. It's okay. Anis. You should speak even more, because you are a hilarious guy, hilarious chap. We are having entertainment here. So I want to just say thank you so much for making time to attend, and I think we have learned something. From our presenters, and as our students join us to practice in this field, we hope that we are going to make our patients' life and safety a priority, so that we can be able to improve service delivery. And I would like us to make a habit of documenting. So, because if you document something, then we'll be able to make a report on it, so that we can build our own database. Just like Anis said, he said that we do not have our population-specific database that we can be able to quote from. We're always borrowing from the US, from Europe, from Japan, and all over the world. So we are trying to build this database through the Farmers and Persons Board, and it's a wonderful one. So I would like to encourage each individual to be able to create an account and be able to participate in pharmacovigilance. Thank you so much.
Thank you. Dr. Wata?
Thank you, Doc. So on my end, it's communicate with the prescriber, confirm that prescription, double check before dispensing, and hopefully we'll minimize our errors. Thank you.
Christina?
Thank you all for attending this. I saw about 630 attendees, and my parting shot for all of us is that let us empower our patients. Let us give our patients all the information that they need, the correct information that they need to be empowered to take their drugs in the correct manner, to ensure that we minimize those medication errors which could be caused by them taking drugs incorrectly. So be the source of information to our patients and to their caregivers. Thank you, Anis.
Thank you. Dr. Christabel, your parting words?
Yeah, just as I mentioned earlier, we all have to work together, not just as pharmacists alone, but we have to work with the other healthcare workers, and we have to engage the patients in whatever efforts we are doing. So before dispensing, let's just find out if they understand exactly what they're taking the medication for. Let's encourage them to also report using the different avenues that have been provided. And as Mangongo has said, and Jayesh, let us document. And apart from just reporting, we also need to use the information we are collecting to make decisions. That's why one is able to keep a track of what they have reported, so that they can use the same information to enhance safety monitoring at their own facilities. Thank you.
Thank you, Dr. Christabel. Hez?
Right, thank you so much, Doc, for the opportunity. Mine is to just appreciate the speakers who've created time to join us today, and also you for moderating this session. For the participants also, thank you so much for joining. We'll be having the videos shared on YouTube. So please, for those who have not been able to join, please share with them so that at least you can be able to work together to reduce medication errors. So my last point will be on let's use the tools that we've been provided with. A tool can be hard sometimes to use at the first time, but then with time, it gets easier to utilize them and they'll be helpful. So thank you so much. Back to you, Dr. Anis.
Thank you, Hez. I also want to thank you for the work that you have done to put today's presentation together. You have done a lot of work to put everybody's slides together and make sure that we are all presenting well. Thank you very much for your time. Thank you to the PSK team who helped to market this event. We are now going into World Pharmacist Day celebrations. So be ready to play your part in the World Pharmacist Day celebrations. Saturday is the inter-university competition at Jakwat, and Friday, Saturday, and Sunday all over the country, pharmacists are celebrating World Pharmacist Day by either having a CPD or doing some talks or doing MTM in different places. So all the best to all the pharmacists. And our next webinar is going to be on Monday to celebrate World Pharmacist Day. Watch this space for more. In closing, I saw a remark from one of our colleagues in Uganda. All I say to him is bring back Migingo. All right, good night and have a lovely night.